Okay, looks like it's time to get started. So I want to welcome everybody. Thank you so much for joining us. I'm Kate Trams, and this is our behavioral health series, which is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. And today we have Steve Steiny presenting on practicing self-care in the helping professions. So we are part of the ATTC network, which also includes 10 regional centers, 5 international centers, a network coordinating office, and the National Hispanic and Latino ATTC. In the next couple of days, we will send out a follow-up email to everyone who attended this training, which will include a link to the recording, handouts of the slides, and a CEU request form. The email that we send out actually gives confirmation that you attended this, so that is something that you can use for applying for your recertification. But if you do want an official CEU certificate, you can request that, and we just ask that you pay a $15 fee once a year for all of the webinars of ours that you attend. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. This survey takes just a few minutes to complete and asks about your satisfaction with the event. This feedback is critical to our future work, so we would really greatly appreciate you taking a few minutes to share your time with us. And we really value your thoughts and opinions on that. So thank you very much in advance for sharing that with us. You will be muted for the duration of this webinar, so please use the chat pod to share your questions and comments, and we'll address questions at appropriate points during the presentation. And I know Steve will explain this a little bit more later, but this particular presentation today is meant to be much more interactive, so we're hoping to have people interacting a lot through the chat. So please feel free, and I hope you all feel comfortable sharing thoughts and responses to some of the topics that we're talking about today. So I want to introduce our speaker, Steve Steiny. Steve is the program manager for the Addiction Technology Transfer Center and has been an alcohol and drug counselor since 1997. He has worked in the behavioral health services and nonprofit sector for the past 23 years and has been in recovery himself for over 32 years and has committed his life and his profession to helping others in the recovery process. So thanks so much, Steve. It's so great to have you here and sharing this with us. And I'm going to pass things over to you now.
Thank you. Thank you, Kate. And good morning, everyone. I am broadcasting to you live from University of Iowa here on campus in Iowa City, Iowa. It's kind of chilly and overcast today, so I hope there's some sunshine finding you in other parts of the country. This may be good morning to some of you and afternoon for others. So I'm really happy to be able to be here. I think one of the things to keep in mind as we go through today's topic, which is practicing self-care, it'll be really important to allow yourself to be interactive in this process. Now, I typically this particular PowerPoint is new. It's my first time kind of running through this particular PowerPoint. And what I will ask all of you to do is to use your chat box to comment, and I'll be asking more so in this PowerPoint today, in our discussion today. I'll be asking you for more participation than normal. Generally, it's just sort of me talking. We field some questions maybe at the end, but I'm really going to ask you all if you're comfortable sharing some stories, sharing some thoughts, some ideas, some feedback, and perhaps even sharing ideas with one another in the chat box. I really wish we were all in the same room together. That's sort of how I designed this when I put it together, was for us to be all together and to have a dialogue face to face. So some of the pieces we'll have to adjust a little bit. There'll be some vignettes we'll look at a little bit later pertaining to self-care, and I would ask, I'll give you guys all some time to read over each vignette, and then we'll have a brief discussion in the chat box. I hope this goes well. I'm sure it will. And if not, I'll learn a little bit from maybe some changes that I need to make. So again, really honored to be here this morning or this afternoon, depending on where you are. Let's see if we can't progress through here. And I'm actually going to make sure we've got the slides that we have. Okay, good. So today's topic, for our discussion purposes, is really going to be practicing self-care, particularly in the helping professions or behavioral health field. And I want to have us keep that in mind. We'll look at some objectives and we'll kind of move through this together. But I'm going to ask you all to participate as we go. So great to see some familiar faces. I love it. Those of you that are just calling in, you'll have to just be um, participant observers, and it'll be harder for you to interact, obviously, without having access to the to the keypad or to the monitor. So really great to see everyone. Before we start, let's just take a couple of minutes to kind of get centered and to kind of clear our minds a little bit as we get ready to have a discussion about a very important topic. So let's take a couple of minutes. Creator, stay with us as we walk through this discussion today. Guide us and help us and protect us. And may all those listening in today and their relatives and family be safe and keep us in your light and your love. Okay, so let's get started here. So one of the things that this first slide I want you to just kind of keep in mind and to kind of get us started here is this idea of how you treat yourself is how you're inviting the rest of the world, and particularly those closest to you or those you spend the most time with. It's how you're inviting them to treat you. I think that's important, and I want to sort of use that as a base or a jumping point for us to build on. So let's keep that in mind. How you treat yourself is how you are inviting the world or those around you to treat you. Here's another something to think about as we begin our discussion today. In the healthcare system or the healthcare world, self-care is it's really seen as any necessary human regulatory function which is under individual control, deliberate, and self-initiated. Some place self-care on a continuum or on this spectrum, with healthcare providers at the opposite end to self-care, while others see it in a complex, multidimensional sort of way. In modern medicine, prevention medicine aligns most closely with self-care. We think about that. And a lack of adherence to medical advice, for example, or the onset of a mental health disorder can make self-care difficult. We know this, right? Self-care is seen as a partial solution to this sort of this overall rise in healthcare cost, and it's also a very fundamental part of health and social care. Means that it's essential. It means that it's essential for us to see it as a component of the modern healthcare system, and that goes for within tribal communities, within mainstream communities. This is sort of all encompassing regarding how we see healthcare and self-care overlapping. So introductions. I think if we were in a group together, what I might ask is for everyone to maybe chime in quickly, tell a little bit about maybe their name or a little bit about themselves, and we would go around the room and do this depending on the size of the group. We have a big group today. What I think I'll ask you to do is to just simply, if you're comfortable doing this, type in um, the capacity or the current role you play in your position if you're practicing either in a clinic or private practice, but type in your role in the behavioral health field and how many years you have been practicing. Can I see some responses perhaps if you're comfortable sharing this? Can I see a few chiming in? Good. Case manager, prevention, substance abuse prevention, substance abuse counselor. Oh, we've got some years. So we have, and we also have some rookies out there too. That's good. You only get one rookie year, so enjoy it. Good. This is good. I'm seeing a wide range of capacities, both in treatment and prevention, mental health. This is great. Yes, I have won 30 years in practice in the social services. Wonderful. Oh, this is great. This really helps me kind of understand. And I would add, as these are coming in, and I appreciate this, I would add the importance of self-care must never be underestimated, folks. I mean, I can't stress that enough. Having practiced for 23 years in an outpatient residential clinic setting, I can share with you that not practicing self-care, not adhering to that can really be detrimental. And I experienced some of that myself, not taking care of myself. And it's very difficult sometimes to go back and replenish if you let yourself go too far. But it may be the single most important practice you engage in during your career in this field. And some of you I know will know this already. Um, it's also, and I believe this strongly, I believe it's the greatest gift you can give um, or offer to your patients, colleagues, and most of all to your family and friends. It really is this idea of self-care to me is like healing the healers, and very, very important concept. So again, I appreciate everybody kind of chiming in during this introduction period. I have some folks, it looks like, in administrative roles. Um, yeah, 32 years. Marcita, it's good to see you on the discussion today. Um, this is great. I appreciate everyone's chiming in. So let's take a look at the objectives today. If we can, and I'm hoping we will be able to touch on all of these objectives today. Certainly not at the depth or to the extent that I would like to, but we're going to review some self-care concepts and principles, and I really will be relying on many of you to provide your own definitions and ideas and what's worked before, what's working now, and how you promote or practice self-care in your own line of work. So let's take a look at some other objectives. I want to explore the role of leadership can have in practicing and promoting self-care. I think that is essential in a clinical setting, in a service setting, to have leadership and management on board with this idea of the direct service providers taking care of themselves. I also, hopefully we'll have a chance, obviously not to the extent that I would like because we're not sitting all together, but I would like to, hear from all of you about some shared and lived experiences and the importance of practicing self-healing or self-care. And then we'll share some strategies too and techniques that you all have perhaps experienced or utilized in practicing self-care and making sure that you are um, uh, taking care of yourself as you help others. And then also just approaches to self-care supported by research, wisdom, and spiritual foundations. So let's keep going. Um, Good, and I see other people are still chiming in with their introductions. I really appreciate that. We've got a wonderful range of different disciplines within the helping professions and a fantastic range of experience levels. So this is what a great group. I really appreciate everyone being here today and giving me a little bit of your time. And it's good to see some familiar names on the list too. So fantastic, fantastic to see everyone. So let's look at this idea and see if again if we were in a group, I would have us sort of create this group definition or have us build a definition as a group. But I'll ask all of you to give this some thought. Um, think about self-care. What does this mean to you? What does self-care mean to you in your practice, in your personal life, in your spiritual life, in your day-to-day living? What does it mean to you? Why is it important? Why is self-care important? And then to build on that, I would want to hear from you about what does it look like for you? If you're practicing self-care, um, what does that look like? Or perhaps what does it look like to see a colleague practice that or to see that promoted in your place of employment? So let's give that some thoughts here. Let's give that some thought and then see if we can have some responses. The classic definition, and sort of the one that I sort of adhere to, is this idea of the practice of taking action to preserve or improve one's health, or the practice of taking an active role in protecting one's own well-being and happiness, especially during times or periods of stress or difficulty. And we know that the field that we are in often involves re-experiencing trauma from our patients or absorbing much of their pain and much of their difficulties. So um, we're going to talk about compassion fatigue and what that looks like, and the difference between compassion fatigue and burnout. But let's hear what some have to say. Self-care. What does it mean to you? Why is it important? And what does it look like for you to practice this? Yeah, Maria's saying, be kind and have compassion towards ourselves to keep balance in the physical, emotional, psychological, and spiritual person. That's great, Maria. That's nice. Zona, life is ceremony, self-reflection, and action with intent and purposeful being, safe expression, validation. That's wonderful. Really, really like that. These are great. Curtis says self-care means that I take time each day to walk around campus. It means time to read each day and meditate. Yes. Sign me up, Curtis. I'm with you, brother. I'm with you. That's good. Um, so these are great. These are things that we, if again, if we were in a group, a small group, we would be sharing and expressing to one another. So these are great. Esther says, tend to yourself like how your mom would, but for grown-ups. That's good. I like that. I like that idea. Yeah. Darlene says, it's gratitude daily. Uh, yes, I like that too. I often have been told there's no way you can be uh, grateful and angry at the same time. The two just can't exist with one another. So I like that as a protective factor, Darlene. Yeah, Katie says, cultivating inner wellness so that I might support the well-being of all. I love that. Many shapes and forms, often involves relationship to earth, dance, connection to something greater. I like it. Um, speaking to the ancestors for help to relieve my sense of burden and to get bigger help on the way, and gratitude as well. That's great, Katie. I love that. These are great, you guys. I really appreciate. It's like more people are chiming in as we go, but these are wonderful. These are the kind of concepts and ideas that I think if we were again as a group, we could share and agree on. And I can see some themes running through some of the chats coming in. Um, in some of the comments and to build on this definition of what it means. Again, I think of it as practicing, this idea of taking action to preserve and kind of protect one's own health so that I'm in a better position to help others. It's that idea too of, when the oxygen masks falls down, I have to put that mask on myself first before I can turn to help the person next to me, or my child, or my spouse, or my parent. I have to first make sure that I am not going to pass out due to lack of oxygen. Does that? I hope that makes sense, and maybe some others have heard that before. Oh yeah. Latrita says self-care is me remaining cognizant of everything happening within me and around me and taking the necessary steps. And she lists a few to make sure that I'm physically, mentally, and emotionally well, so that I can be the best for those I help. That's exactly what I'm talking about. Yes, Elizabeth, deep breathing, closing your eyes. Yeah, this is good. Good, yeah. Sonia, you understand that oxygen mask example. That analogy is one um, I've used often in different contexts, but it certainly applies to this one. So that's great. I think we've got a good group here that not only understands self-care, but also understands how to put that into practice. And those of you that may be new to the field, or maybe this isn't a strong point for you, today we're going to share some ideas and hopefully build on this as we move forward in our own work with others. So I want to talk about compassion fatigue and burnout. And the two, I used to think they were the kind of the same thing. And um, after sort of stepping back a little, and since I've been out of the direct service field now for a little over a year, um, I've had a chance to sort of digest a little bit and stop and take a look at this. Compassion fatigue and burnout are different. They have some similar effects, but they're different. Compassion fatigue is, think of it as this sort of state of tension and preoccupation with the trauma that your patients are experiencing, and it comes out in many ways, including maybe re-experiencing some of these events. It's similar to sort of like a critical incident stress, um, being traumatized by something you actually experience. But compassion fatigue is more where you're absorbing this trauma through your patients. It's also referred to as secondary post-traumatic stress. Whereas burnout is really associated with the stress and kind of day-to-day challenges involved in your work. Uh, it's very cumulative and it's relatively predictable, um, and frequent. Being able to take time off or maybe switch a job description or job duties sometimes will help this kind of burnout syndrome that happens. But more specifically, I think of compassion fatigue as originating from sort of trying to absorb or deal with victims of trauma, and whereas burnout originates from the occupational stress of being overworked. And two alternative names again, for this idea of compassion fatigue are secondary traumatic stress and vicarious traumatization. So I can assure you that from my own experience, compassion fatigue is real, and it is debilitating. And if you're not taking care of yourself, um, it will diminish your spirit, and those that suffer the most will be those closest to you, and of course your patients will not get the best version of you as you assist them in trying to understand and assign meaning and purpose to their recovery and their lives. So yes, Anna is mentioning this is why ceremony, sweat lodge, and Sundance is helpful for healing oneself. I agree. I've only experienced a few sweats over this past year and one Sundance, but the rejuvenation that I experienced there was palpable, and so I can agree with you and to that extent. Yeah, these are great. Some great comments coming in. So I want to draw a distinction though between compassion fatigue and burnout. They're two separate but very equally debilitating experiences. So again, I think at this point, what I would ask the group to do is to give me some of their thoughts and ideas and stories related to compassion fatigue. Maybe some of the veteran clinicians in the group might want to share a story or an idea if you're comfortable doing that. I think that would be helpful for the group to see. I assume everyone can see the chat box as it scrolls. But at this point, I would ask the group, if we were face to face, to share thoughts and stories and ideas related to the previous slide. This idea of compassion fatigue or burnout. We often are absorbing a great deal of trauma and pain from our patients, and this has a cumulative effect on our spirit and our emotional state. And so maybe let's see what some of you would like to share about compassion fatigue or burnout. Yes, this is good. So Latrita says, do you all discuss those? Do you all discuss those who naturally feel the emotions of others and how they would deal with compassion fatigue? Yeah, I don't know. She's asking maybe the group that question. And Katie says, I think compassion fatigue is a consequence of oppression, as well as where an antidote can be to honor practices of protection or renew more fully. Yeah, I would like to talk more about that. I wish you were right here with me, because I would want to delve into that a little deeper. And then Katie goes on to say maybe burnout is and compassion fatigue is less of an issue when you are supported to renew and retreat as part of facilitating healing. That's yes, and we're going to talk a little bit about leadership and how your role as a leader or mentor or supervisor can really spearhead this idea of your staff taking care of themselves. It was funny because at the clinic where I was managing the outpatient. The last decade that I was in the clinic, I was managing the outpatient operations there, and I promoted self-care like it was the greatest thing ever, except I wasn't practicing the very thing that I was telling my staff to. So it was a real trap for me, not being able to do what I was trying to promote in others. So yeah, Maria says, accept with compassion how our job may affect us to prevent compassion fatigue. Yeah, I like that. Yes, Sonia, I agree. Processing, she says, make sure she's processing her own grief and loss emotions. Yeah, Bonita, yes. She says, in Indian country, we're all closely related. Suicide and health-related loss is a weekly occurrence. It's very difficult for our communities to recover. We go into schools and promote resiliency. That's beautiful. Thank you for sharing that. That's good. I really appreciate you sharing that. So we have a few more comments coming in, but I think again, I think what we would want to be able to do if we were in a group, more of a live group, is to really maybe even break into small groups and share some stories with each other in a more intimate setting. And you're not required to type in any comments if you're not comfortable doing so. I just want to give everyone out there listening a chance to comment if you're comfortable. So Yeah, Kristen says we've incorporated mindfulness activities into our school prevention programming. It's good for staff and students. So I agree, Kristen. It's good to see you in the group discussion today. I know you have a lot to offer in regards to practicing self-care. Um, and Darlene says difficulty administrators, at least here, we do not have the support that is offered to our own patients. There, therein lies one of the great injustices. Um, the most important people are those that are on the front lines providing those direct services, and they need to be supported with majority of the resources of that clinic, um, because they're the ones that really they are the primary actors in the production, and they need to be fully supported. So that's a great point, Darlene. I appreciate that. Yeah, and Latrita agrees. So that's why part of today, at the end, I'll be asking you all to make some commitments to taking this idea of self-care out to your colleagues and to your supervisors, or as administrators or supervisors or managers yourself, revisiting this and seeing what you can do to promote some change within your agencies or clinics. And this here we go, practicing what you promote. Um, and we're talking about this, what works for you and what you would suggest um, to others to practice and promote self-care. We're going to look at some vignettes in a little while, and we'll have a chance, maybe as a group, to assess what we would do to try and help this person, either as a peer or as a colleague, or perhaps as a supervisor or manager or administrator. So, but this idea of practicing what you promote um, was something that I admittedly fell short of in the later years working in the clinic that I was at for so many years, and it cost me dearly. So I can't stress how important that is. So keeping in mind what works for you, what you would suggest to others. Yeah, there's some great ideas coming in. I like the idea of small steps, modeling how to do self-care, thanking people when they care for themselves. Yeah. Um, but having some guidelines and framework and suggestions for practicing self-care. This can come in the form of a policy within the agency. It can come in the form of procedures, or within departments having enough of the staff cross-trained to cover for one another that it makes it possible to have staff step out and take some time to replenish and um, rejuvenate themselves. Yes, Evangeline says her self care is lacking, but the staff that I supervise are allowed time for self care. Yes, you know, that's I was there with you. I was in that same sort of predicament. Yeah, Kristen lists off some really wonderful strategies and different procedures and techniques. Good. Yeah, that's good, Sonia. I like that. Shutting the clinic down on a Friday afternoon so everybody can have a little time to reset. Curtis says small steps. This is good. Oh, these are wonderful. I hope you guys can all see these, and I think Kate said that this will be recorded, so we can look at these. We can look at these later too. This is wonderful. Yep, Darlene, good. Even if you have to take paid time off, that's right. Gosh, if you were here, I would definitely give you a high five. So I'm with you. Yeah, Pete, I love that spiritual bank account. That is a great concept. I love it. Yeah, music can be a wonderful way to rejuvenate. Practicing one's spirituality. That's good, Pete. I love it. Um, Yep. Marcita. Yep. Staff development events, activities. Yes. These are great, you guys. Thank you so much for chiming in. This is really, I think, again, if we were to group together, this would be part of us creating some healing within the healing, some meta healing, if you will, talking about the process of healing and being supportive. Yes, Katie, I agree. I laughed my way through many a situation. Humor is absolutely essential. I think without my sense of humor, I would not be here today, right now. So I couldn't agree with you more. Sense of humor, that's one of the things that have really endeared me to many of the native communities and tribal members that I've met over the years. Just a wonderful sense of humor that we can share and find humor and healing through that means. So I couldn't agree with you more. This is great. Thank you so much for these. Yeah. Maria says eating properly, understand healthy emotions, education, and then prayer, utilizing prayer. I think that's wonderful. Oh, these are great. Thank you so much for your interaction. So self-care is important. Um, I think we can agree on that. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. Somebody mentioned that earlier. This is a quote from Eleanor Brown, who is a famous author and speaker and teacher. And so I think those are words to live by. This idea that I can't give what I don't have anymore, um, because my vessel is empty. So that gives me some incentive to want to keep myself full and rejuvenated so that I can continue to give away what I have to help others. It really is essential. So this idea of teaching, I think I want us to think for a moment. Of course, Maria, I appreciate your comments, and you're welcome. Appreciate that. So this idea of teaching. So I mentioned this and referenced this earlier, but your role as a mentor, your role as a leader, supervisor, administrator, manager, in whatever capacity, but your role as a leader can really set the tone for making sure your colleagues or your staff or supervisees are taking care of themselves. That it be the norm rather than the exception. And I think there are a lot of administrations out there. At least I experienced this in my own clinic, where there was a lot of talk about how important the staff were and how much they wanted to be cared for, but when it came down to it, it was lacking, and that was really the shortfall of that clinic that I spent my entire career at. And so I guess some of the questions that I would ask you. Um, Yes, Latrina, I agree. You teach others by example. I couldn't agree more. Um, I guess Latrina has kind of kicked us off here. How you teach others. So how do you do that? How do you teach others? What are your methods and principles for teaching others? I agree. Leading by example, leading from the front. I used to say to my staff, uh, I work for you. You don't work for me. I'm here to work for you. My job is to make sure that you are in a good place, supported, that your job is manageable and meaningful, and that you feel supported so that you can go out there and help those patients that need you. Um, Absolutely essential. Hard to put into practice, but very essential to having a proper model for teaching and to show. I'm a visual person. I always learn through example. It's just how my mind works. Um, yes, I love that. I love that quote. Um, Latrita, yes, I think that was who was that that said that famous person. Um, People may forget what you said, but they'll never forget how you make them feel. And I love that. Who was that? Somebody help me here. That was a famous person. She's passed recently. Can't think of her name. African American woman. I'm drawing a blank on her. Someone's gonna get it for me. Um, but Latrita, I agree. And you say you make this statement because when I'm here at work, I often share from my overflow. I've been asked how I'm so positive and in tune, and I tell them I take care of me first, and that's fantastic. Yes, Maya D'Angelo. Yes, thank you, Kristen. I knew you would save the day. Yeah, Maya Angelou. Yes, perfect. Thank you. So let's continue to think about how we teach others and how we show others what it means to practice self-care. Oh, I love that, Zona. Honesty, transparency, humor. Boy, that is right on. Um, that is right on. Um, so this idea too, I want to talk a little bit about this idea of living and learning. Uh, I think this notion or idea of having these learned experiences and utilizing them as a conduit or a vehicle for learning and growth, um, and then really having some shared values or sort of ways of living to help guide us, and I think those can be uh, anchor points moving um, through our own living and learning and sharing and growing. Um, these are just some of the sort of values that I pulled from some different sources, um, and I think that they're worth consideration. Uh, Wisdom, humility, caring and compassion, generosity and helping, truth and honesty, and spirituality. Um, yes, I like that. Billy says, I work with people from age 70 to 60. I have to meet them where they are when teaching. I agree. You've got to be able to shift gears. I experienced a lot of that in working with youth and young adults. If you try and communicate with them in the same manner as you would an older adult or someone who is advanced in their substance use disorder, you will not get real far in your teachings. Um, and Kristen says sometimes we have to retreat into our own departmental space with an agency to make sure our staff is cared for, listened to, and that they know that their direct supervisor supports and appreciates them. You got that right, lady. I can say lady because Kristen and I have a previous work history. So thank you for saying that. So living and learning, using our learned experiences as tools to help us teach. And then I want to build on this idea of leadership as well, because I think that is also some of you that have been in the field for a while may have experienced some of this. Some of you that have evolved or moved into uh, managerial or administrative roles. Uh, Really, if you've come from direct service and moved your way up, I think you have an appreciation for what it takes. So that those, in my experience, have been some of the best leaders and mentors that I've had in my own experience are those that have experienced what it's like to be to start in the beginning and move up, so that they have that perspective. Um, I'm a person of long-term recovery as well, and sometimes that would can offer another vision or another perspective on issues related to substance use disorders. Not saying you can't be a good clinician or a good provider if you're not in recovery, but I also would say that those of us in recovery who are working in the field really have an extra understanding or sense of what it means to be on the other side of the desk, so to speak. Um, so, but leadership, I think leadership can really some things to think about. How can your role as a leader impact self care for you and for others. But I put you in there because, as many of us have mentioned, it's easy to try and get everyone else's oxygen masks on, and then I pass out because I forgot to put mine on, and then Steve's no longer able to help anyone because he's starved his brain of oxygen, which really probably happens. It could happen to me anyway, even without putting a mask on. But anyway, but just the idea of promoting self-care, leading from the front, I think, as others have mentioned, making it a priority, and creating a culture of love and healing. And I think that that idea of creating that culture um, is something that doesn't happen overnight, and it has to be kind of everyone on board with it. And if it doesn't exist at the upper levels of leadership, it's very hard for that culture to be created and maintained in the staff. I'm not saying it can't be done, um, but it's very hard to have it be a collective norm and part of the culture of the clinic or the agency. Um, and then this idea of giving to receive. The investment that I made in developing my staff and supporting my staff as a leader would always blow back to me tenfold. And I always would say I am only as effective as a leader by those that I've surrounded myself with. And I think that really there's some real truth to that. It's not I'm not just offering this as anecdotal, but I am um, you know can relate to you on my own experiences. But I think there's some evidence out there too, some data that would support this idea when it comes to leadership and promoting ideas or culture or support. Um, yeah, Elizabeth says that as a supervisor, I try to learn how each staff member likes to be uh, incentivized or recognized to show appreciation for the individual's contribution to the work. Some like public recognition, other like small gestures. Yeah, I agree. This is good. So, and then just some other things on there, just actions over words. So, I used to say to my patients oftentimes, your actions will speak much louder than anything you can say. Um, and I think that holds true from a leadership position as well. I could say self care is really important, but I really need you to work over the weekend too. Sorry. Uh, so, and that's, I'm being kind of flippant about that, but the idea of having, as a leader, saying this is important, but then I respond through policy or procedure or decisions in the opposite way. I think that sends mixed messages and causes a lot of dissension. Can anyway. So again, I think if we were in a group, we could talk a little bit about this idea of meaning and purpose related to the work that you do and how self-care is directly connected to the meaning and purpose that you attach to the work that you do and the patients that you work with. So I would say to all of you, uh, again, to give this some thought, how does this idea of self-care, healing and replenishing your mind, body, and spirit, how does this relate back to this idea of meaning and purpose to the work that you do? How are those two connected? I opened that up for some comments in the chat box. If we had a group here, I would be asking for some comments. So how does the idea of self-care and healing and replenishing your mind, body, and spirit connect to this idea of meaning and purpose in the work that you do? Take a couple of minutes to see if we get some thoughts to that. It's I think it's important to make this connection. Yeah, I agree, Maria. I agree. Yes, that's true, Robin. I agree. Yes. So Curtis, I would say, how does that connect to um, this idea of meaning and purpose. How does that affect the meaning and purpose of the work that you do? Yes, Esther, tell me more. I don't know if I quite understand. 8 years ago, my 3-year open. Not sure I quite understand, but tell me more so I can understand what you mean. Yeah, Sonia says when you're fatigued and you struggle with your own purpose and the energy required um, to step into others' lives to help them. Yeah, yes, yes, that's good, Katie. I like that. Yeah, yes, yep. Inner sense of humility and integrity. And that is connected to the meaning and purpose of the work that you do. Um, it's really from my own experience, uh, directly connected to my human condition and how essential it is to have meaning and purpose. Without meaning and purpose, I'm adrift. My spirit is adrift. Um, my mission and my direction are lost. I like that, Darlene. Simply clarity. Yeah. Okay. Okay, Curtis. I agree. The process meaning being the the assignment of meaning and purpose happens over time. Is that what you mean? Yeah. 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 Right. That's a tough spot to be in, Billy. I appreciate your comment. Yeah, that's good. Yeah, I'm going back. I'm looking at Katie's comment again, the second part of that. I'm the facilitator, not the healer. That's good. Yeah, these are great. So think about again. Think about how taking care of yourself and practicing self-care is is directly connected to the meaning and purpose and your perception of the work that you do. Hmm. Oh boy. Yeah. Thank you, Esther, for sharing. Hmm. Thank you. Uh, Hang in there, sister. I'm with you, and I appreciate you sharing that. That means a lot that you would share that with us and with me and the group. That's good. Yep. Yeah. This. Well, you guys are right on here. I would love to have you guys all in the same room. We would. I think we would probably really be able to connect. This is great. I appreciate everyone's comments. Fantastic. I'm going to keep going here. So I want to build on this meaning and purpose idea and relate it to the notion of hopes and dreams. Um, I truly believe that, and I would say, how do hopes and dreams, how do those relate to self-care? And these are just some things to think about. Uh, I feel as though hopes and dreams are reflected in your interactions with those closest to you. Um, these will often be revealed to you in your worldview and what's meaningful to you. They may be closely connected to your values, spirituality, purpose, and priorities. And I truly believe that your hopes and dreams ebb and flow over time. They grow with you and change. They come to fruition, fall short. They're recreated and perhaps come full circle. the older I get, the more I see things coming full circle, and the more patterns that I see in my relatives and those that came before me. Patterns, both good and bad, that sometimes repeat themselves. But this idea of hopes and dreams, what I'm asking you as a group to do is to think about how this is connected to self-care and how this may connect to the patients that you work with. Yes, Desiree, I don't disagree. I mean, hopes and dreams are a luxury, the very top of Maslow's hierarchy. You have to practice self-care to even get to that point. I agree. I've talked to one person here, Sean Barron. He talks about the sort of Western world. The Maslow's hierarchies are sort of like this, where the point of the pyramid is here, um, kind of in the Western world or non-native world, but in native world, the Maslow's hierarchy is sort of inverted the other way, and I'm still trying to understand this fully, but it's important for me to keep these things in mind as I depart from my own linear sort of thinking and my own westernized upbringing and thought to see things on a more global and interconnected level. Yeah, Maria, I agree. A hope with a plan of action, so it will not become just a dream. That's good. That's deep. I gotta think about that one. So again, I'm asking you. Um, I'm evoking some thought here. I really want you to think about how you taking care of yourself is connected to uh, the development and the maintenance and continuation of your hopes and dreams, and how these directly impact the patients that you work with and the family members that you connect with, the relatives and ancestors that are part of you. Yes, Curtis, we're right on. We're on the same page, brother. This is good. Thank you so much, everybody, for sharing these thoughts on the chat board. I know it's not quite the same as being together, but it's as close as we're going to get. I just really appreciate everybody being on. It's fantastic. I want to look at some vignettes now, and normally what I would do is, and we're not going to spend a lot of time on these, but if we were in a group, I would have you break up into probably three groups of, whatever, three groups of 18 or 17. We'd break up into three groups, and I would distribute these three vignettes. We're just going to look at them together, and then maybe make some comments about how we might assess or support this person in the vignette, practice self-care, or help us understand maybe what's going on with this person. So these vignettes are they're not culturally adapted. So I apologize. I think Sean Baer, our co-director, and I are working on trying to come up with some culturally adapted vignettes. But for now, I just have sort of some generic sort of vignettes that I want you guys to look at. So, oh boy, can you guys read that? I hope that you can see these. I thought I made the print a little better. Can you guys see? Can you guys see that vignette one? I know the print is a little small, but okay. Latrita says she can see it. Okay, everybody can see it. So take a couple of minutes to read
You
through.
can make it.
What's that?
Oh, I was just gonna say, you can make it bigger by using like the full screen button in that pod.
Oh, great.
It's like the four arrows pointing outward. If you click on that, it'll make the PowerPoint a little bit bigger, so it should be easier to see that way too.
Try that. It seems like everybody's able to see it. Oh boy, that's wow. I can really see it now. I've just lost everything else. So let's take a couple of minutes on a look at this. Read through this. Let's spend the next couple of minutes looking through. This is vignette one. This is about Gary. any typos or grammatical errors, I'm going to blame on my editor and my author, which is me. As you read through this, and when you feel ready to do so, um, give me your impression about what's going on with this individual and what might be a good suggestion or action plan um, for you as a manager in helping Gary maybe address some of his self-care needs. Kate, can I get out of this by just hitting escape? Will that take it back down to a smaller?
If you hold your mouse up at the top again, and there's that four arrow button should be there. You
Oh
just
yeah.
click that same button again,
Thank
and
you.
it'll
Thank
bring you
you.
back.
Thank you. I appreciate that. Yeah, Kenneth, I can relate. I hope you are able to connect with someone close there and get the support that you need. I that's a tough place to be when your spirit is diminished like that. So what do you guys think? And thank you for sharing that, Kenneth. I appreciate that. What do you guys think about this first vignette? What are your impressions here? Um, what's going on here? Do you think with Gary? Yes, Latrina, I agree. He's burying himself. Doesn't want to deal with his grief and loss. Yeah, that's close. I think that's close. There's no right or wrong here. We're just sort of trying to imagine yourself as the manager, and he's part of your staff. Discuss his workload. Yeah, yeah. Maybe send him to a training or find out what he would do if he took a couple of weeks off. And it is multi-layered. I know. Yeah, I couldn't have this be too easy. I wanted you guys to think a little bit about what's going on. Um, he's mourning. Yes, I agree, Esther. He's mourning, and he's using work as kind of a shield. Yeah, I agree, Maria. That's a big piece of this. The therapist, I agree. The therapist needs a therapist. Yes, I have a very good therapist. She's wonderful. She and I meet, every couple of months, and or I mean, twice every month, and it's important. It is his own individual way of coping. I agree. Yeah, yeah, yeah. You guys are picking up on this. Yeah, good. So we might. What do you think? We might try and see if we could help manage Gary's caseload a little bit. We might see if he would be willing to connect with a therapist to maybe do some grief and loss work, and maybe see if he wants to take a little time off to recharge and replenish. Yes, I like that, Curtis. Have him go for a walk. I used to do what was called walking supervision, or I would take my staff and we would walk and talk, walk around the block. Or that's a good point, Larita. Latrita, I think he probably those acute cases probably really help him focus and not look at himself or something. He needs balance. Yeah, you guys are right on with this vignette. Yeah, maybe there's some insecurities there. It could be. Yeah, I like that, Katie. See what he's willing to share and what's going on. Yeah, he seems to really feel obligated to try and help everyone, and I'm not sure where that's coming from either. So we could spend some more time on this vignette. I want to move to the next vignette. We may not be able to do all three, but let's take a look at this next vignette. Let's take a couple of minutes here to kind of read through this. Now this I think is related to uh, a clinician or a counselor who is part of your private practice. So she's more of a colleague, I think, if I remember this one right. So you're not really in a supervisory role here, but you're more in I think you're in more of a colleague or peer colleague role. But let's read a little bit about Nancy here and hear what your thoughts might be. Once you get a chance to kind of read through this, maybe let's hear some comments from the group about this next story. What do you think is going on with Nancy? And though we may not be able to give her direct suggestions, as we're not in a managerial or supervisory role, but if she's part of the practice, it may be important to understand what's going on. Yeah, maybe she may be getting burned out. Share her story. Yeah, what she's struggling with. Could be a mental block. Does it say how long she's? Yeah, I think she's a skilled or kind of a veteran therapist, and she's having difficulty remembering things. Could be. That's a good point, Latrina. It could be something neurological. We don't know, but I don't think we know how old Nancy is or what her age is in this particular story. Yeah, I agree, Katie. Um, yeah, yep, yep. Uh, Kenneth, I think we go till 1:30. If you're wondering how long the webinar is. Kate, how many slides are we in? I can't see the slide count. Not sure how many slides we're in. So that's oh yeah. Nelda says she read a book about cognitive decline. It may be something neurologically related. So we don't know. This is another vignette we can take a quick peek at. It's another scenario, and this one has a little different spin on it, but it's something I think is important to acknowledge. So so we have Paul. He's relatively new to the clinic, um, but this comes up. This event comes up. Tell me what you think about this one. Um, Paul Paul is in recovery, so that's I think a key point here. He's in early recovery and is very open about this with both patients and colleagues. Yes, I agree, Sonia. It can be it can be difficult for uh, clinicians in recovery to find a good, solid impaired professionals group or recovery group. And we're doing good on time here. I think we're fine. I think yeah, that's good. Yeah. Yeah, Darlene says it's a setup for failure. Offer time to go out of town meetings and self care. I agree. I mean, he's showing early, or initial signs of perhaps, relapsing. Yes, I like that, Nelda. Maybe get him connected with somebody um, in employee assistance, EAP programming. Yeah, that's good. So you guys are picking up on that. Yeah, I agree, Christina. He does need more support around his recovery. If he can't go to meetings in the area, uh, he needs some other means of support. I agree. Um, yeah, these are good. Agree. Finding alternative outlets or other resources, groups or counseling. Yeah, I agree. Good. Well, that's great. I think if we were in a group setting, I would have us maybe into groups and report back in small groups um, on our findings for each vignette. But this went better than I thought it would. So thank you for your comments, everyone. And this is good. This is going to help me when I do this in New Mexico with our leadership group next week. So thank you. So what do we know? What do we know regarding self-care? What do we know? Uh, Again, I've been asking what works for you. I think some things, as we've talked about that, and some of you have shared, which I've really appreciated. I think it's important to know that there isn't sort of a universal sort of remedy or universal guideline for this. It's different for everyone. There may be some similarities and some overlaps, but it may be affected by culture. It may be affected by the part of the country you're in. It may be affected by your own values, your own uh, policies at the clinic that you are at, the different environments that you're spending your both professional and personal time in. But I think it's important that there are some universal elements that are directly connected to the human condition that transcend culture and uh, race and gender and other differences. There are these fundamental or universal elements that we all can connect to or relate to in some on some level regarding self-care and what works. Knowing that it's not something there isn't a cover-all or a blanket solution because everyone will find different pathways to practicing self-care. This is another quote by Diane von Furstenberg, and I thought it was important. The most powerful relationship you will ever have is the relationship with yourself. And I like this notion. I think of this as this idea that I really can't have right relations with others until I have a right relationship with myself. And I've experienced that both early in my recovery and later in my recovery. I know Kate said I had been in recovery for 32 years, and I just want everybody to know I was only 5 years old when I got into recovery. I'm kidding. I was very young. I will admit I was about 20 years old. So, but I think it's this. This is what the quote made me think about is having right relations with myself. so that I can have right relations with others, whether it be a patient, colleague, family member, or a friend. I hope that makes sense. Yes, yes, Maria. Wherever I go, I always take myself with me. That's right. That's right. Me, myself, and I on the road. Yeah, this is good. So, um, again, I think at this point, if we were in a live group together, I would ask for some discussion or some thoughts or some ideas. I think that we've had a pretty good discourse throughout the presentation today. I want to put this idea out there, this idea, and I mentioned this earlier, this notion or idea of coming full circle. Um, and I think that I've always felt this way in general, but I think it's made it even more clear to me as I have uh, begun my learning process about Native American cultures and trying to understand this on a more global and broader perspective. But this idea of things coming full circle, of being in a circular motion, um, let's apply this to the context of self-care, and and this idea that um, self-care is equivalent to or leads to healing, and that includes those four um, important aspects: mind, bodies, spirit, and emotion. That this then creates or potentially creates a sense of balance, which then allows us to provide self patient care, adequate and meaningful and purposeful patient care, which then reinforces the importance of self-care, and the circle completes. Um, I've always liked this idea of I sort of end up where I started. In this context, I think it also applies. I don't know what your thoughts are about that group, but I think if we were all here, I would ask for some thoughts or some additional comments about that idea in the context of self-care. Anybody have any thoughts or ideas about that? And then again, I think um, just to look at this in this way, and again, I'm non-native, but I'm trying to understand how this the four directions and this idea overlay not only with recovery but with practicing self-care um, as a practitioner or as a clinician. And it really makes sense to me, even in my initial understanding and learning and being taught about um, Native culture and Native American ways. This idea sort of overlays this what we've been talking about with self-care and covering these four directions, these four areas of my being, mind, or body, emotion, mind, and spirit. Um, so I don't know if there are comments that others would like to make about this, or thoughts about this that provoke thoughts or comments. Looks like we have a couple people typing. Hmm, I like that. Sonia says a quick way to evaluate where you may be lacking is when you recognize which area, mind, body, emotion, or spirit is the strongest. But then if you have a weaker area, you may need to embrace something you wouldn't naturally gravitate to for a coping skill. I like that. I like that. Which is sort of, that's not, for me, that's not intuitive. I usually want to just stick to what I do well or where I'm strongest rather than looking at my weakest areas or areas that I need help with. So that's a good point. I appreciate that. So let's look at just some strategies and techniques. Now I know because we're not in a group, it's a little harder for me to maybe spend some time generating some ideas from the group, but just some things that we've touched on that I also found in some of the literature and some of the research conclusions out there. There are a lot of uh, publications about self-care, but just some of the things that we've talked about and that also are reflected in the research. Um, eating right, practicing mindfulness, um, keeping track of accomplishments. I know at the clinic where I worked, it was always very easy to feel like you weren't making a difference because the patients that did well and responded to treatment, you didn't see them again because they didn't need you anymore. They went on with their lives, but the patients that kept returning were those that were struggling. And so it was very easy to think that we weren't accomplishing much or making a difference. We talked about expressing gratitude. Um, there's this idea of sort of tending to your inner child, creating a cozy or supportive environment, reading, um, physical exercise is very emphasized in many of the literature publications and publications out there about self-care. I box 3 times a week, and it's absolutely a lifesaver for me, just neurochemically to get moving, and my cardio is decent as a result too. So just unplugging. They talk about unplugging, getting away from putting your work cell phone away, unplugging if you can, very important. Um, Create something, whether it's art or music. And then I like this idea, we kind of touched, some of you touched on this, but building a self-care kit. Um, it says, have a basket with some of the things that make you feel good. Um, for me, it might be chocolate or good coffee or maybe you know, 9 holes of golf. I got to have that on a standby when the weather permits. That makes me feel better. So, but things like that, having a self-care kit, those were just some of the strategies or techniques that I found sort of themes in some of the research. Um, Again, the research, looking at that, there are infinite opportunities for personal growth, self-care, and genuine stress relief that don't require a lot of resources, or you have to get stressed up about planning it. But it allows us to take a genuine break from this goal-oriented sort of linear, metric-driven thinking, and then just being able to relax a little, not be so hard on ourselves. Um, and we talked about laughter as healing. I think that came up in a lot of the research that I saw. The use of humor, um, and then being able to document and share um, some things that work for us when we do need to feel better. Sharing that with our colleagues and friends and staff, and um, sometimes for better or worse, there's no app or amount of money that can help with things. Sometimes you really have to just go back to the basics. And there was an interesting statistic. The American Psychiatric Association reported that 39% of U.S. adults feel more anxious than they did a year ago. We continue to glamorize being overworked, busy, and stressed. Numerous studies support this. For example, the Journal of Consumer Research has published a research showing that Americans associate busyness, I don't know if that's spelled right, yeah, maybe it is, busyness and stress with our prestige and our status. This might explain why counting our steps and recording our exhales are satisfying ways to measure the success of our self-care routine once we leave the office. But, but in this context, our anxiety becomes just another thing to work on. So don't make your self-care practices, I think what they're saying, don't make your self-care practices create more stress for you. 2017, the review of meditation studies from the past 2 decades, um, he dispels this. David Creswell dispels this idea, the misconception that mindfulness is a proven panacea for anxiety, depression, chronic pain, stress, and more. Still, he points out some impressive findings. Mindfulness can reduce activity in the amygdala. This is the brain, the region of the brain responsible for the fight or flight response. I just thought that was incredible. Mindfulness meditation has also been shown to reduce levels of interleukin. I'm not sure, this must be something in the blood. It's a biomarker in the blood. This interleukin 6 biomarker in the blood that is elevated in high stress groups. So I thought that there is some evidence to support mindfulness as a healing technique. And then this I thought that was interesting too. UK-based marketing professor conducted a study analyzing the effects of wearing a Fitbit on a group of 200 women. The women said that the devices made them feel guilty whenever they fell short of their goals. 79% felt pressured to reach their daily targets, and 59% went so far to say that they felt controlled by their devices, and nearly 30% referred to their Fitbits as the enemy or an enemy, which I thought was, that just sort of defeats the purpose of the Fitbit. I don't own a Fitbit. I don't know who does, but I thought that was an interesting little comment. So in summary, I think self-care, some say, is a lifestyle. It's a self-created culture. It's a way of living and seeing the world. It's hard to establish, harder to maintain, and probably the hardest to master. But evidence from today's discussion and some of the comments that you all have made have told me that there are many of you on the call today and involved in our discussion that are not only aware, but have proven techniques and strategies that you're utilizing with yourself and your staff to make this possible, to take care of yourselves, to secure your own oxygen mask before you help those secure theirs. So again, I think we're just about out of time, but I wanted to at least leave a couple of things open for comments and questions. Let's do this. Take this with you. Think about 3 things that you'll continue to practice in 2020 regarding self-care. Think about also 3 things you will support others in practicing self-care in 2020. And then perhaps, as someone mentioned, looking at areas that you want to improve, think about 3 things you will explore and try for the first time regarding self-care practices in 2020. Those are some things to consider and things to take with you as we conclude today's discussion. This, I think, if you want to hear a little bit from this gentleman named Ralph, his last name is escaping me, but he's got this really intriguing self-care series on YouTube. I just found him very infectious and really enjoyed listening to him. But there's a link here. I was going to show you a little excerpt if we had time, but we are out of time. So really, again, I want to appreciate and thank everyone for joining me today. Really enjoyed the interactiveness that we could generate. Um, and let's just close now with just a brief moment, kind of clear our minds again. Let ourselves just get centered. Thank you, everyone. I really appreciate your time. There's some resources that you can check out if you're interested. A couple of things I pulled from, and a couple of books I would suggest if you're interested in practicing some self-care. Um, those will be available, I think, on the recorded version of this. So, and some other links to some other self-care resources that I discovered. So, again, I think I'm 1 minute over. I want to thank everyone for joining today, and have a great rest of the week. We'll talk to you again soon.
Thank you, everybody, and thank you, Steve, for this great discussion and leading us in that. And so, yeah, I really appreciate everyone joining us and being a part of this discussion. It was great to see all the suggestions and support that everyone was giving each other. So, thank you for that, and we hope you all have a great day. And with that, we'll wish you well. Thank you.